I'm going to be introducing some legislation this week that would allow states to opt out of Obama healthcare. I think Obama healthcare as currently drafted is bad for America. The individual mandate, the employer mandate are really going to drive up cost, and it's going to consolidate power in the federal government. Private companies are not going to be able to afford the individual, the company mandates, and they're going to start dropping coverage on their employees. They're going to wind up in government-run systems, which I think is the goal of this bill. The last thing in the world we need is the federal government to take over health care. We need more private sector choices. The individual mandate is an attempt to do that. If you don't buy the health care, you pay a fine, and a lot of people are going to wind up getting into government-run systems. But the real problem for South Carolina from the Obama health care proposal is the expansion of Medicaid. If this becomes law by 2014, the Obama health care bill, 29% of South Carolinians will be Medicaid eligible. 150% above poverty level allows you to be on Medicaid. That would require the state of South Carolina to come up with $1 billion more in money they don't have today to get federal government Medicaid dollars. You have to match. For every state dollar you put on the table, you get 3 Medicaid dollars from the federal government. But the problem with that is that the second largest expense in our state budget is Medicaid matching money already. If you expand to 29% of the state being eligible, you're going to bankrupt South Carolina. We'll have to start either raising taxes or cutting money we spend on education or public safety just to do the Medicaid part. So my bill, along with Senator Barrasso from Wyoming, a physician, is to allow states, if they choose to opt out. Remember when Governor-elect Haley asked President Obama, could we opt out? And he suggested maybe you could. Well, that's never going to happen the way the bill is written today. 200-something companies have been given waivers in terms of the mandates in this bill. What I want to do is give every state the ability to opt out if they choose, and take this fight from Washington down to the state level. And I believe if the state of South Carolina could, the governor and the legislature would opt out of Obamacare before it drives businesses out of the healthcare business and before it bankrupts the state through Medicaid expansion. So this will take the fight from Washington down to the states. It's a way to repeal and replace Obama health care with you, the average everyday citizen, through your elected state representatives having a say about what you would like to see happen. My goal is to replace this bill with something better, opting out as a form of repeal and replacement.